Have you ever received an unexpected bill or penalty and wondered if there was anything you could do about it? It can certainly be unsettling to face additional costs, especially when it comes to something as important as health care. Many people ask a similar question about Medicare Part B penalties, wondering if there is a way to have them removed or reduced. While it is generally difficult, and often not possible, to get a Medicare Part B late enrollment penalty completely waived, there are very specific and limited circumstances where it might be successfully appealed. The key lies in understanding the precise reasons for an appeal to be considered. Medicare Part B penalties are designed to encourage timely enrollment. They apply if you do not sign up for Part B when you are first eligible and do not have other credible health coverage, such as through an employer or union. The penalty is an additional 10% for each full 12-month period you could have had Part B but did not sign up. This amount is added to your premium for the rest of your life. However, if your penalty resulted from an error made by a government agency, like the Social Security Administration or Medicare itself, you may have grounds for an appeal. This also includes instances where you received erroneous written information directly from Medicare or Social Security. Proving that the error was not your fault and was clearly due to a government agency's mistake is crucial. Unfortunately, simply not knowing about the enrollment periods or deadlines is typically not considered a valid reason for a waiver or appeal. If you believe your Medicare Part B penalty was applied due to an administrative error, the first step is to contact the Social Security Administration. You will need to explain your situation and request a reconsideration of the penalty. Be prepared to provide detailed documentation to support your claim, such as copies of letters, official forms, or any written communications from a government agency that prove you were given incorrect information. You should clearly state why you believe the penalty was applied in error and how the agency's actions or information led to your delayed enrollment. Filing an appeal means presenting a strong case with concrete evidence. Understanding the difference between the initial enrollment period and special enrollment periods is vital for avoiding penalties in the first place. Your initial enrollment period is a 7-month window around your 65th birthday. Special enrollment periods allow you to sign up for Part B without penalty if you had qualifying employer group health plan coverage after your initial enrollment period. If you did not have creditable coverage during periods when you could have enrolled, the penalty almost always applies for the duration of your Medicare Part B coverage. Knowing these periods and their rules is truly your best defense against late enrollment penalties. Ultimately, preventing a Medicare Part B late enrollment penalty by understanding and adhering to enrollment deadlines, or by ensuring you have qualifying creditable coverage, is the most straightforward approach. However, if you do find yourself facing a penalty that you believe is unjust due to an agency error, pursuing an appeal through the Social Security Administration is your recourse. This process requires thorough documentation and a clear demonstration of how specific government agency actions directly contributed to your late enrollment. It is about proving a procedural mistake, not about personal unawareness.